The role of the COE is to bring together NATO nations and partners to train together and learn from each other. The COVID pandemic has emphasized the importance of disease surveillance and managing outbreaks and deployments, and makes training in this area even more relevant. The Force Health Protection Branch has been working with the French Military Center for Epidemiology and Disease Surveillance, called CESPA, for several years to deliver a NATO-accredited course on disease surveillance and outbreak management. This course is held in Marseille and takes place over 1 week.
So what we expect from the student of the level 1 is that they will be able first to detect if there is something wrong happening, so to detect an outbreak, and then how to seek information, how to take action, how to manage it, who to contact, with whom to interfere and to communicate correctly with their leader, with the commander on the place, with the medical advisor. Also, this course for them, it's a good opportunity to make some new contact, to have a network of people working in the same field of them. Also, it's very important, like for exercise, to make simulation with different nations, different competence, different skills, and to learn to work together in an international context.
And my favorite part of this course is actually the simulation part of it. I think the students really learn well through that, how to use teamwork in an outbreak investigation, and use all of the skills that they've learned throughout the rest of this course.
How this will relate to me moving forward is, especially as we deploy to work with other NATO nations, especially as we look to work in the health surveillance and make sure we keep our personnel safe to reduce and stop any pandemics or diseases from happening or getting worse, and then stop them in the future.
I hope it's gonna help me a lot for the cyber expertise, and it was delightful to work with this cooperation and international people who come from Canada, United States, Hungary, Germany, Belgium, and many else. So I found it really interesting to know how the other people work and used to work, and how they manage their team and how they manage their outbreaks in their countries. I'm glad to have been part of that.
In fact, it's something that is challenging because I need to generate an outbreak that must be realistic, so very realistic, while artificially generated. That is, I must simulate, create a virtual world composing of the pathogen and the peoples involved in the outbreak and the environment of the outbreak.
First of all, I want to say thank you to the people that are responsible for organizing that course. I think that course is very important for the nations, and particularly to the Portuguese army. Because in Portugal, the people that are responsible for the investigation outbreaks are veterinaries. That's why I am here to do this course, and I think it's very important to improve our capabilities about investigation outbreaks.
The course covers several important areas for medical personnel, either deploying on a NATO mission or those responsible for organizing medical inputs into missions. Topics include an overview of EpiNATO 2, the only disease surveillance tool being used in NATO, an approach to the management of outbreaks, and also practical exercises to embed learning and practice interpreting data and knowing what to do with it.